Good morning, my YouTube viewers. Palestine here. Welcome to my channel. I've got so many videos that I would like to make, so much to do, but this video I'm going to talk about the progress of my mother's health because I'm sure a lot of people want to know how my mother's doing. Basically, so I rang my mom last night. She's in a rehab center, and basically she doesn't like it there. She's having to go to occupational therapy, physical therapy, speech therapy. And so I phoned her and spoke to her. I pay £6.50 to be able to speak a month, to be able to speak to my mother 100 minutes a month. And so if I talk over 100 minutes, I can't talk to her again until after the month is ended, and then the 100 minutes starts rolling again. So that's a problem I have, and one of the reasons why it would be nice if she was on Facebook Messenger, because if she was on Facebook Messenger, then I could phone her for free. But she's not on Facebook Messenger because there's a password on her iPhone. She doesn't know what the password is, and I'm sure if she was motivated enough, if I was one of her girlfriends, definitely she would find some criminal to unlock that phone and take that password off the phone. But I'm not as important to her as her friends are, apparently. So anyway, so I phoned her last night at rehab, asked her how she's doing. This room that she's staying in, there's actually got another bed in it so people can stay the night with her, because apparently my mother can't be left on her own. So she's accustomed to being babied. She's accustomed to being babied and pampered and everything else. So she can't be left on her own. So people have to actually go spend the night with her. If they don't spend the night with her, she can't sleep very well. She wakes up in the middle of the night, she gets confused, and then she tries to get up, which she can't do. And so she's still in a neck brace. She's going to have to wear a neck brace for 1 to 2 months. And then I asked my mom, I said, well, how long are you going to be in rehab? Because I thought she was going to be in rehab for 1 to 2 weeks, but my mom thinks that she's going to be in rehab longer than that. And she said the reason why is because she can't do the things that they want her to do. Obviously, with rehab, they're trying to get her up walking, but she doesn't want to walk because she's afraid that if she walks, she'll fall again, which is a good fear. And then so I asked her about her speech because she has to see a speech therapist as well. And then she said, she says that she thinks that she's having problems with her speech because of the stroke. That's what my mom is calling it. My mom is calling it a stroke. And basically what my mom's friend said was it was a bleed on the brain. And I didn't know what a bleed on the brain was. So I looked it up, and a bleed on the brain is a type of stroke. And so basically, so she did have a stroke. And so my mom is saying that she can't walk and she can't speak because of this stroke. And that's what my mom is calling it, a stroke. But her friend called it a bleed on the brain. And then so I talked to my mom for a little bit because what can she say? She can't say very much. She's stuck on, well, she was in a hospital and now she's in rehab. She's stuck in rehab. And even before she had this fall, because she got dizzy and fell, and she got dizzy because she had a bleed on the brain. Even before this happened, I would phone her up, and there wasn't much to say. There wasn't much that I could say. So the only thing that I could do is talk to her about my life, talk to her about what I'm doing, because my mom, she's not doing much of anything. She's just laying in bed, really, So just to show her that I care, I phone her up, and the only thing I can talk to her about is my life. So I tell her what I'm doing. And I just told my mom, I said, well, you're really lucky that you've got friends rallying around you and supporting you. I said, because when I was harassed out of my job at Foster Wheeler, my friends didn't support me. My friends didn't rally around me. I said, they actually took Foster Wheeler aside. And that's because Foster Wheeler had sent its employees out to contact them and say things about me to my friends. And I said, yeah, I told her, I said, all of my friends all of the people who I was friends with when I was at Foster Wheeler, they're not my friends now. They're not my friends now. I said I had to make new friends. And I told her, I said, all my friends now have disabilities. They're all disabled. Usually it's one person has paranoid schizophrenia, and she's my friend. And then two people have learning. One person has dyslexia. One person has autism. And my boyfriend, he has a mild learning disability because he can't use computers and he's really slow. And I have to help him a lot. And I have to push him, just like yesterday, I have to push him to go into the computer and enter the data into the spreadsheet. So if I make a spreadsheet for him, he can enter the data into the spreadsheet, but he can't actually make his own spreadsheet. He can't design his own spreadsheet. But I design a spreadsheet for him for his new job, and he's able to input the data into the spreadsheet. And I say to him, I said, you've got to get in the habit of every day when you finish delivering leaflets to enter that data into the spreadsheet. And then I can help him with it. I can help him calculate totals and things like that for him. But all my friends that I had at Foster Wheeler, they're gone. You didn't see them for dust. They weren't interested, But so I had to make new friends, and my new friends now have disabilities, and I guess they consider me to be disabled because what Foster Wheeler did to me. So I guess I'm considered disabled too. So I talked to my mom about that, and then my mom said, oh, well, I'm going to have to let you go. They're going to be coming to get me soon for more physiotherapy or occupational therapy, physiotherapy, speech therapy. And so she's not really happy about it. She's not sleeping. She's not happy about it. She says she can't do the things that they want her to do. And she thinks it's because of the stroke. She says she's having problems speaking and she can't walk because of the stroke. So we'll have to see how that goes and see where we get in that regard. And I spoke to my boyfriend about this, and we talked about it privately, what our opinions were. And so that's it, concluding the progress of my mom, which I guess she's out of an imminent danger now. She's in a neck brace. She's going to stay in the neck brace for 1 to 2 months. She's in rehab, but she's having problems speaking. She's having problems swallowing. She doesn't have an appetite, which is a good thing. And she can't walk. So that's it for her. So you just have to, if you are a prayer, if you want to keep my mom in your prayers, that would be good. I actually put her predicament on this Facebook page that is with my church, and I update the church on her progress, and I say thank you for your prayers. I don't say please pray. I just say thank you for your prayers. And another thing that happened was, on Wednesday, I had my dental appointment. And so I don't have another dental appointment for 6 months. But, my teeth, it doesn't look good. Because now that I've got osteopenia, they said that's going to affect the bone and my gums around my teeth and around my implant. So I'm going to try to keep my implants as long as possible. But I guess at some point I'll probably have to have dentures, So I'm not looking forward to that. And then also my legs hurt, my thighs hurt, and my knees hurt and everything. And I think it's the bones. Because I have osteopenia, which is just one step before osteoporosis, my bones are really weak. And because my bones are so weak, I have to be really careful, because if I fall, I'll break a bone. And so I thought, oh, well, that's good. I'm not going to have another appointment until June 2nd. And then June 2nd, I've got this eye appointment at the eye clinic. And then I thought, oh, well, I'm going to be finished with my doctor's appointments for a while when I have this appointment at the eye clinic. And I don't know what they're going to do. I guess they're going to check my eyes. And I think the appointment is like 8:30 in the morning. So I hope it's not going to last beyond 10, because if it lasts beyond 10, then I have to ring up work and say, I'm really sorry, I'm being held up at this doctor's appointment. I didn't know how long it was going to last, and it's overrun. But yesterday I received a text message from my doctor's surgery saying that I have to have a blood test at the local hospital. So I don't have to have the blood test at my doctor's surgery, because I could go to my doctor's surgery to get the blood test. They want me to have the blood test at the local hospital. And so basically I had to do an app. So I had to fill around on an app to try to schedule a blood test, because that's the way it's done now. You don't deal with people anymore. It's all computers. So I had to click onto a link, which I'm not happy to do. And then this link brought me to this appointment system for the local hospital, and then I didn't have an account with it, so I had to I had to create an account, and then I had to do all that stuff just to make an appointment for a blood test. So this blood test is going to be on, I think, 16 June at 2 o'clock. So I'm just going to leave work, and then when I've left work, I'll go directly to get the blood test. So yeah, I thought I was going to be finished with all of my doctor's appointments, but it looks like that's not the case. I have to get a blood test now. I don't know what the result of the blood test is going to be. And so I'm over there trying to log on to this system, create an account for this system, and make an appointment for this blood test. And my boyfriend's trying to talk to me about his problems. And so I do have a lot to do. I'm not a very healthy person, but I do have a lot going on in my life. So I think that concludes this video, because I've updated you on my mother's health, which isn't great, and I've updated you on my health, which isn't great, and the fact that I'm going to have to get a blood test. So my doctor's appointments are not over. I thought in June my doctor's appointments would be over for a while, but nope, I have to get a blood test. I don't even know what the blood test is for. I don't know what the outcome of the blood test is going to be, but when I find out, I'll let you know. So thank you so much for watching my video. If you like my video, please like and subscribe. It means a lot to me that you are taking an interest in my life, as pathetic as it may be.